Welcome to Tinnitus Mastery, Nursing Management and Clinical Diagnostics. I'm Mr. Nagesh Sir from ND Nursing Coaching. Let's start with our first question. Which of the following best describes tinnitus? Is it the inability to hear external sounds, perception of sound in the absence of external auditory stimulus, severe vertigo and loss of balance, or acute inflammation of the middle ear? The correct answer is B, perception of sound in the absence of external auditory stimulus. Tinnitus is defined as the perception of sounds like ringing, buzzing, clicking, or hissing when no external acoustic stimulus is present. Next question. Tinnitus that is audible to both the patient and the examiner is called subjective tinnitus, objective tinnitus, sensorineural tinnitus, or conductive tinnitus. The answer is B, objective tinnitus. This type can be heard by an examiner and is often caused by vascular abnormalities or muscular contractions, unlike subjective tinnitus, which only the patient hears. Which medication is a classic cause of drug-induced tinnitus? A, acetaminophen, B, aspirin, salicylates, C, vitamin D or D, insulin. The correct option is B, aspirin, salicylates. High-dose aspirin is a well-documented ototoxic agent that can cause reversible tinnitus by altering cochlear hair cell function. What is the common association between tinnitus and Meniere's disease? A, tinnitus is absent in Meniere's. B, tinnitus is a core feature of the clinical triad. C, tinnitus only occurs after surgery. Or D, tinnitus is always objective. The answer is B, tinnitus is a core feature of the clinical triad. Meniere's disease is characterized by a triad of vertigo, sensorineural hearing loss, and tinnitus caused by endolymphatic hydrops. Which assessment is critical for a patient complaining of unilateral pulsatile tinnitus? A, vascular evaluation, B, tuning fork test only, C, blood glucose monitoring, or D, urine analysis? The correct choice is A, vascular evaluation, for example, checking for carotid bruit. Pulsatile, or rhythmic, tinnitus is often vascular in origin, such as from carotid stenosis or a glomus tumor. Auscultation for bruits is essential. Which class of antibiotics is notorious for causing irreversible tinnitus and hearing loss? A, penicillins, B, aminoglycosides, C, macrolides, or D, cephalosporins? The answer is B, aminoglycosides. Drugs like gentamicin and amikacin can cause permanent hair cell damage in the cochlea, leading to tinnitus and sensorineural hearing loss. Tinnitus retraining therapy, TRT, aims to A, cure the physical cause, B, habituate the brain to the sound, C, increase the volume of tinnitus, or D, remove the earwax? The goal of TRT is B, habituate the brain to the sound. TRT uses sound therapy and counseling to help the patient's brain stop focusing on or reacting negatively to the tinnitus, a process known as habituation. Which diagnostic test is used to rule out an acoustic neuroma in unilateral tinnitus? Is it MRI of the internal auditory canal, X-ray of the skull, Romberg test, or caloric test? The correct answer is A, MRI of the internal auditory canal. Acoustic neuromas are tumors of the vestibular nerve, and MRI is the gold standard for visualizing these retrocochlear lesions. What is the role of sound masking in tinnitus management? Is it permanent elimination of noise, providing a background sound to make tinnitus less noticeable, blocking the ear canal completely, or increasing the perceived volume? The answer is B, providing a background sound to make tinnitus less noticeable. Masking devices use sounds like white noise to decrease the contrast between the environment and the tinnitus, making it less intrusive. Which is the most common conductive cause of tinnitus? Is it acoustic neuroma, impacted cerumen, presbycusis, or ototoxicity? The correct answer is B, impacted cerumen. Earwax impaction is a common, reversible conductive cause of tinnitus that typically resolves after removal. Which of these is a risk factor for developing chronic tinnitus? Chronic exposure to loud noise, regular dental checkups, wearing prescription glasses, or a vegetarian diet? The answer is A, chronic exposure to loud noise. Noise-induced hearing loss frequently accompanies tinnitus due to chronic damage to the cochlear hair cells. A patient reports clicking in the ear. This might suggest middle ear muscle spasms, sensorineural hearing loss, presbycusis, or acoustic neuroma. The correct option is A, middle ear muscle spasms. Rhythmic clicking is often associated with palatal myoclonus or spasms of the tensor tympani or stapedius muscles. Which psychological condition is often exacerbated by severe tinnitus? Anxiety and depression, schizophrenia, bipolar disorder, or obsessive compulsive disorder? The answer is A, anxiety and depression. Chronic tinnitus is a significant stressor that frequently leads to secondary anxiety, sleep disturbances, and depression. What is the first step in the assessment of tinnitus? Audiometry, history and physical examination, MRI scan, or prescription of anti-anxiety drugs? The correct answer is B, history and physical examination. A thorough history and physical exam, including otoscopy, are mandatory before ordering expensive tests. Which systemic disease often correlates with tinnitus? Diabetes mellitus, iron deficiency anemia, rheumatoid arthritis, or hypertension? Which of these systemic disorders can cause or exacerbate tinnitus? A. Cardiovascular issues. B. Metabolic disturbances like diabetes. C. Thyroid dysfunction. Or D. All of the above? The correct answer is D. All of the above. Cardiovascular issues, metabolic disturbances, and thyroid dysfunction can all impact cochlear blood flow and nerve function, causing tinnitus. Why is caffeine consumption discouraged for tinnitus patients? A. It improves sleep. B. It may worsen tinnitus due to stimulant effects. C. It reduces blood pressure. Or D. It has no effect on tinnitus? The answer is B. It may worsen tinnitus due to stimulant effects. Caffeine is a nervous system stimulant, and many patients report that it exacerbates their tinnitus. What is a key nursing intervention for tinnitus-related sleep problems? A. Complete silence in the room. B. Using a white noise machine/fan. C. Heavy sedation before sleep. Or D. Avoiding all fluid intake after 6 p.m.? The correct answer is B. Using a white noise machine/fan. Background sound helps mask the tinnitus in a silent room, making it less prominent during sleep. Which of these is not a goal of tinnitus management? A. Reducing the perceived volume. B. Decreasing emotional distress. C. Complete destruction of the auditory nerve. Or D. Improving coping strategies? The answer is C. Complete destruction of the auditory nerve. Management focuses on minimizing symptoms and maximizing coping and quality of life, not destructive procedures. Is tinnitus contagious? A. Yes, B. No, C. Sometimes D. Only in children. The answer is B. No. Tinnitus is a symptom, not a disease. It is not infectious or transmissible. What is somatosensory tinnitus? A. Tinnitus influenced by jaw or neck movement. B. Tinnitus caused by loud noise exposure. C. Tinnitus related to blood pressure. Or D. Tinnitus. That sounds like a roar. The correct option is A. Tinnitus influenced by jaw or neck movement. This type is linked to dysfunction in the cervical spine or temporomandibular joint, where somatosensory inputs affect the auditory pathway. How does physical exercise help with tinnitus management? A. It directly repairs inner ear damage. B. It reduces stress and helps focus. C. It significantly increases blood pressure. Or D. It makes the patient hear the tinnitus less. The answer is B. It reduces stress and helps focus. Exercise promotes psychological well-being and reduces stress, which is a major trigger for tinnitus. Which of the following is a symptom of eustachian tube dysfunction that can cause tinnitus? A. Oral fullness. B. Vertigo. C. High-frequency hearing loss. Or D. Profuse ear drainage.